You know, when it comes to getting relief from pain in your back, your neck, you want to go to someone that's reliable, a reliable doctor. Well, today on the show, we're at the office of Dr. Vince Mitchell, the Back and Neck Care Center here on Pass Road in Biloxi. And talking to Miss Yancey, how are you? It's good to meet you.
Doing fine, thank you.
Tell us why you came to Dr. Mitchell.
My main problem is my knee. I couldn't walk upstairs or walking, period. It hurt. And also I have trouble with my neck.
Right.
My head's on too tight.
How did you hear about Dr. Mitchell?
I got a little mailer in the mail that invited me to a lunch. It's one of those you say, well, you're not going to go because all they're going to do is try to sell you something. But I went anyway. And he listened to his talk, and he convinced me. He convinced me.
Well, I mean, I've heard so many wonderful stories about him. I mean, what other treatments had you tried up to this point?
No treatments, actually, just pain pills. I did have cortisone shots in my knee, and
yeah.
they last for about 6 months, and then it's a mask.
And after a while, you're right, and after a while, there's really, you know, unless you're going to have surgery or something like that. But
don't want to have
But he
that.
helped you without having surgery.
Yes, he did.
I mean,
yes, he did.
That in itself is awesome. I mean, let's say percentage-wise, how was your level of pain relieved?
Mostly 70, some days even more. Some days it gives me no problems at all.
Really?
Yeah. I go to the football games. I can go all the way up top bleachers and sit underneath the little box now.
Well, you mentioned to me before we started taping, you went to the gym 3 times this week, and I was embarrassed. I only went once. So.
Yeah, I go more now.
So, and I guess you would strongly recommend him to anyone else.
I have, and I do, yes.
And so the treatments are easy. And just come in a couple times and get them. Huh?
Very easy. Yes.
All right.
Yep.
Ms. Yancey, thank you so much.
Thank you.
Congratulations to you anyway.
All right.
All right. We've got someone else that we want to talk to and find out the type of relief that they have received here by coming to Dr. Mitchell and see if it works out good for you. Ms. Northrup, another patient here of Dr. Mitchell's. Now, like Ms. Yancey, your issue was your knee. Now, hers was knee and neck, and yours was actually knee and lower back, but taking care of the knee has kind of helped the lower back. Well, first off, how did you hear about Dr. Mitchell?
I was in a meeting, and he come and spoke to our meeting, at our meeting.
Okay, all right. And what type of symptoms were you experiencing? You mentioned your knee.
Yeah, I was having a lot of difficulty with the knee and the lower back, and he's straightened me out 100% since April of last year.
Okay, all right, so it's been a while. What kind of issues were you having with your knee? I mean, hard to stand? I mean, it was swollen or what?
Yeah, it was hard to stand and climb upstairs, and it was just there, that pain,
How
feeling.
long had you been suffering with this pain?
Oh, for a while, I'd say 2 or 3 years.
Wow. And
I just ignored it.
You kind of try to shut it out, but after a while it gets to where you can't do it anymore. What other kind of treatments had you tried?
I've had the shots, they call them the rooster comb.
Yeah,
I've had 2 different sets of those. The first set really helped, and the second set never did help. It didn't do anything. When he spoke about it, he said if he could help me, he'd let me know, and I came and he helped me.
That's awesome.
Yeah, it's great.
So has your quality of life improved since you started getting these treatments from him?
Oh, yes. Oh, yes.
All right, so let's say as far as let's say on your scale of 1 to 10, it used to be a 2 when it was bad.
Yes.
What is it now?
Oh, it's up there at the 9.
Wow, that's amazing. So, I mean, you really have got quite a bit of improvement on that. So you have no problems. You don't sit there and rub it all the time anymore.
No, I sure don't.
And that's probably a lot of relief to you.
Yes, it is.
And
really.
I guess you definitely recommend Dr. Mitchell.
Oh, yes, and I have recommended different people. I talk about Dr. Mitchell all the time. Anybody says they got a pain, I say, well, you need to come to him.
Call Dr. Mitchell because he can definitely help you out.
Yes.
So there's 2 great stories of people who've gotten relief by coming to Dr. Vince Mitchell here at the Back and Neck Care Center on Pass Road in Biloxi. So let's talk to the man himself, Dr. Vince Mitchell. Dr. Mitchell, good to see you again as always.
Thanks, Jim. Thanks for coming.
Thank you very much. You know, we're in a brand new location. I want to mention that first here on Pass Road in Biloxi. You are between DeBees and Eisenhower.
Yep,
So
that's correct.
kind of where the V is right there, the new building.
That's right.
But let's talk about the ladies here that we just talked to, Miss Yancey, Miss Northrup, and the issues that they dealt with, and what you do to deal with people that have knee problems, back, neck, whatever.
Okay. Yeah, knee, we are a chiropractic office, and what I found through the years of treating patients like Miss Northrup or Miss Yancey, that they would come in and we'd get results for them through chiropractic, but we weren't getting the results that we were hoping. Okay, so I had to do something different, and so for the last few years, became more trained in functional medicine, functional neurology, and so we incorporated different avenues of how to really treat the knee pain, to really understand what is knee pain and how is it evolving. Typically, when we see patients like Miss Yancey or Miss Northrup coming in, is that we'll do an evaluation on them, and dollars to donuts, we usually see a back type issue, a hip issue, okay, that's out of alignment, and then the quadriceps and the muscles in the legs become weak over time as we age. So they become atrophy and they become weak. So every time they take a step, that knee will tend to slide on that meniscus, and that'll cause that meniscus to wear down. Also, you have nerves that come off the back that feed that tissue. So we have to address not just the knee. I think people, or prospective patients that come in, they think the problem is just in that knee, and that's where they're feeling it, but we've got to look at the overall person.
Well, the skeletal system in itself, I mean, there's so many things and nerves and stuff that connect with each other.
That's right.
You know, if you look at, you know, one of those big charts with all that, it's amazing. And as you said, something in the back's could be affecting the knee.
That's right.
Vice versa.
That's right.
Or
That's
all the way up to the neck.
That's right. As you heard those two ladies earlier, is that they were helped tremendously. And when they were told that, hey, they're going to have surgery. And when we take x-rays of them, we see a lot of these patients that have bone on bone, or they're told they have bone on bone, and we take an x-ray and they don't have bone on bone. So it's really puzzling to me saying that somebody told them that they had bone on bone. So we're just trying to give them the answers. We're here to educate, motivate, and inspire them to find out there's other options out there for them. So, so when we develop this program, we allow patients to come in for $89. They can come in and we can take an evaluation of them. We'll give them up to 2 trial treatments. So we guarantee results up to 2 treatments. Okay, it doesn't mean we're going to fix them 100% correctly, but we've got to get a result within those 2 treatments, and we'll accept them as a patient. If after those 2 treatments we don't get a result, I will not accept them as a patient. So just like our neuropathy program is that it's for $89, they can still come in, but we got to evaluate them as well to rule them in and rule them out for care.
That's amazing.
Very easy.
Yes, definitely.
Yep.
Good to see you again. Thank you
You're welcome,
very
Jim.
much.
Thank you for coming in. Appreciate
The
it.
new office is absolutely beautiful.
Oh, thank you.
Really
Appreciate
like
it.
this.
Appreciate
and
it.
a
We
great
love it.
staff of people here. So if you need to make an appointment, what you do is you know, call, set up your appointment, and then you know, definitely come in and as you said, get evaluated on it.
Yes, sir.
And see if what they do here can help you out. It's the Back and Neck Care Center. They're on Pass Road in Biloxi.